Well, mental health is still an important topic to discuss, and we have now Gina DeMent for the Mental Health First Aid for Veterans. What are some of the things that are important to always remember when it comes to veterans? What are the things they need for mental health that stands
Well, a
out?
lot of times for veterans in mental health, they don't go and get the services they need. There's a lot of things that they're trained while they're in the service about being strong and resilient, and they are. But when you do need help, it's important to find out where the resources are, where to go to get them, and what are the signs and symptoms. Mental Health First Aid does that. We do it for family members and veterans. If someone's having some kind of difficulty, we say, what are some signs and what are some symptoms that you may have that you can kind of think, something's going on with this individual, how can I help? So this course does that. It offers them that help that they need in that time of crisis until the appropriate help gets there.
And we're here at the Women Veterans Summit, so are there certain things that women need differently than the men for the veteran side of things?
I would think that they go through a lot of different types of trauma, and women medical conditions can be very different than men. But as far as a lot of trauma that women have experienced in the service is something that we see a lot of, and knowing what those signs are for stress and trauma and post-traumatic stress disorder are important for family members.
What are some of the methods that are taught that have been working really well? What are certain things that stand out that really hit home easiest to the biggest variety of veterans?
Well, I am not per se in the, I'm not a psychologist.
Right.
I am a trainer. So what I actually do is deal with the training. But there are a lot of therapies out there that really do help the veterans. But as far as what I do, it's more of the training aspect of what are the signs and symptoms and where do you go to get that help that they need.
But you've got to at least see that there's certain things that you are teaching that are important, that you make sure you know this first. What are some of those things?
Well, some of the things that we teach in here are depression and anxiety, and a lot of the signs and symptoms are the same in that. So we talk about if they are, how do you approach them to go get them help. One of the outcomes of depression and anxiety is suicide, and that is on the rise for our veterans. And so we say, what are some of the things that you might hear them say, or some of the things that they may do? What are signs and symptoms? How do you approach them? And so many people are afraid to say, are you thinking about killing yourself? And it's very hard for the normal person to say that, but we teach that. And we ask them to be very direct and to have them respond back. Many times they won't say yes the first time around, but if you ask it twice, they'll sometimes say, well, I've been a little down lately, I've been upset, and then let's talk about it. We teach them how to be non-judgmental in their listening skills and in their conversation with that person.
I know that unfortunately suicide rates for female veterans right now has been on the rise and is a growing number. How do we make sure that we try to connect the best we can to those people who need this most right now?
One of the main things is for them to know those resources, and I noticed as I walked around the conference today, there's a lot of great resources here. We have managed care organizations or LMEs in the state that can assist them with that, and there are helpline numbers for each one of those in the state, and they can call that helpline number. They then connect them to the Veteran Crisis Line, and they will contact that Veteran Crisis Line. That Veteran Crisis Line will then send them over to the proper provider in that community to provide them with the assistance that they need.